Hello, everyone. It's Monday, May 16th. We have good news, surely really tough news on these families, and I want you to remember them. And we have two losses or two deaths since the last time we were together, and I'm sure that there's maybe some lag over the weekend and all that, but these they're telling me these are absolutely two different individuals. They're the same age, from the same county, the same sex. They're the 6,894th death is a 74-year-old female from Berkeley County. 6,895th death is a 75-year-old female from Berkeley County. I hope I said that right on the first one. I'm going to do them again. The 6,894th death is a 75-year-old female from Berkeley County. And the second death is a 6,895th death, is a 75-year-old female from Berkeley County. These families are hurting, and their loved ones are hurting. And I ask for the prayers for these great, great, great ladies that we lost, all the wisdom, all the goodness that they've given each and every one of us. We're up to 1,964 active cases in West Virginia now. It just keeps bumping up, bumping up, and bumping up. We have 1,305 new cases in the last 24 hours. Our daily positivity rate is 11.58%. Our cumulative stays about the same because it doesn't move, but very slowly, 8.10. We have 497,974 people that have recovered in West Virginia from this dreaded pandemic. We have 129 folks that are now hospitalized, 24 in the ICU units and 11 on ventilators. And we have 29 green counties and 26 yellow counties in West Virginia. Anybody can look at this and see that our numbers are going up. I watched a broadcast earlier this morning, very early this morning, and they said basically the CDC is predicting the next couple of months to be pretty good months, some pretty slow months and everything. So we're really looking at June, July for this thing to not be aggressively moving up, but it's moving up in West Virginia. And that could very well be a backlog or could whatever it may be, but the bottom line to the whole thing is one thing. And I don't know how many times I got to say the exact same thing. But the bottom line, without any doubt, is we got to live with this. We can live with it. It can absolutely be managed. The way to manage it, the way to live with it is booster shots, vaccinations. Stay on top of your game. Use absolutely our calculator, that we have that you have up there that is going to notify you as to when to get your shots and everything. Absolutely, without any question, the way to live with this dreaded killer is to absolutely manage it. Manage it. And to be able to do that, you need to absolutely be getting your booster shots, getting your vaccines. That's my opinion. Without any question, more and more and more people are going to die, and we can make it less and less and less. Without any question whatsoever, I don't think this thing's going to leave. I don't think this thing is just miraculously going to evaporate. I think we have to find a way to live with this. And if you believe in the words that I'm telling you, and I promise you, with all in me, all I have done is tell you the truth. The good and the bad, I have told you absolutely the truth all the time. I believe, Jim Justice believes, this thing's not going to go away. And if it's not going to go away, then how do we handle it? We live with it. We find a way, just like we have lots and lots and lots of dreaded diseases throughout all of our past, we found a way to live with it. We can do that with this as well. There's no need in me going back through all the booster information. I've already just been through that. I feel like I'm, just at times I'm either preaching to the choir people really believe or barking at the moon. But in that, you and I both know that we can absolutely accurately measure how many people have gotten their first shot in the last few days or the last 30 days. It's substantial. And so we want to all continue to try to encourage everyone we can to get those shots. And be respectful, Be super respectful of people's freedoms and their choice, because that's what's made us really great in this country. But encourage, please encourage. As far as the vaccine distribution update and everything, we're at, the numbers continue to just barely move to a positive, in a positive way. We're still at 90.9%. I'd like us to hit 91 and then just keep on moving on the 65 and olders. But everything that we have in us tells us this disease attacks predominantly the older folks. Those are the most susceptible. And with all of that, the 50 and olders, you've got to get your shots, and you've got to get that booster shot. Like I said, the vaccine calculator's up. It gives information on when to get your next shot. All the other information on our vaccine info line is up. Take advantage of the free testing. We have 39 outbreaks in our long-term care facilities, none in our church community, 16 inmates and 18 staff cases now. It worries me when the staff cases start up and everything, because the staff members are the ones that are going in and out and everything, and could very well be bringing more and more, contagious events into our corrections facilities. And so it worries me to see them move up and everything, because right behind that, you see the inmate numbers pop up. The rental assistance program and the homeowner assistance program are still both available to you. It is absolutely, how in the world could you not take time to just call and see if there's some way you could qualify for some level of assistance that may be able to help you? Just take the time to call us and let us see if we can walk you through it in some way, somehow, get you qualified. And if we can, it'll help you, it'll help all of us in the state of West Virginia and everything, because we want these Fed dollars spent in West Virginia. So nevertheless, check on it. From the standpoint of giving blood, I've said over and over how important that is, how vital it is to all of us and everything. Please consider. The Job Jumpstart Program is off and going. I told you about the two ladies at the drive-through window and everything, how excited and how proud they were to be back at work. There's a bunch of people that are getting back to work, and this little program has helped a bunch get across the finish line. We want to just absolutely just keep it going and everything, and hopefully we'll drive that unemployment lower, even lower than it is at record after record. So let's just keep pushing that down, keep creating more and more records. That's great stuff. I went to the Coalfield Expressway announcement in Welch the other day. A lot of driving, crisscrossing all the way across the state and everything. And there I'm with Jimmy Riston, and Jimmy's done an incredible job. Honest to Pete, it is amazing what these people are doing. And I could not be more proud of them and everything. And like I said, that end of the world, they need this Coalfield Expressway finished. We've got a bid went out, and the successful bid winner was the Bezak Construction Company out of Lexington, Kentucky. It was a $147,618,000 bid that they put in, and won the bid to build a 5.12 mile section of the Coalfield Expressway from Welch to West Virginia Route 16. And it is just another piece. As we keep piecing it together and everything, we'll eventually get to the end of the rainbow here, and we'll get this thing done. I am totally committed to believing without any doubt the #1 most important project in West Virginia is Quarter H. But the #2 most important project in my eyes in the state of West Virginia is finish the Coalfield Expressway and bring southern West Virginia into our world, into the entire world. These people deserve it. They've given so much, especially from the standpoint of those great coal miners and their families down there that gave us the energy to power the country, and absolutely gave us the great coal qualities, the great metallurgical coal qualities to make the steel that probably won the wars and everything, that give us everything we have today. And they still are doing it, and so with all of that, we want to help these people, and It is a gigantic priority on my watch, and I am absolutely committed with all in me to do any and everything I can do to get this great highway finished. The only other thing is the ARP money, the American Rescue Plan money and everything is, the second tranche of that has come in now. We need to be prudent and smart in what we're doing. We just offered up, with the legislature, a $250 million out of the first tranche of ARP monies that was really set aside to do matching grants for water and sewer projects across the state. Now look, when it really boils right down to it, how many water and sewer projects we basically went defunct, and we did very few for a long time. Now we're really after it. Our people deserve absolutely clean drinking water, and absolutely, without any question, our people deserve sewer projects that will absolutely make us better and better. Our people in this great state deserve that. Now, with all of that, we've been so upside down in the decades of the past, and we didn't have any money to turn around. We didn't know what to do, and now we got it going. We got it really, really going. And so with this and everything, we're just going to try to do more and more and more goodness for West Virginia. We're grateful to get another tranche of the ARP money, and the biggest challenge we have, and I think the legislature and I are doing exactly that. Manage it. Run the store the right way. Don't just throw away stuff on pet projects and stuff like that. Manage it and everything, and that's what we're doing. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And in support of what the governor has just told us, we do see another surge that is happening both in the United States and also in West Virginia. As we look at the cause of that surge, we see that this is another form of the Omicron variant of COVID-19. As we look at the impact of this Omicron variant, we see that this variant is continuing to change, to mutate, and those mutations allow the virus to escape our immune system more easily. And we also know then that the biggest defense that we have against the new variants of COVID-19, the Omicron variants, and now the BA2 variant, which is what we're seeing in West Virginia, and there's other forms of this variant that we see in the eastern part of the country, which is even more infectious and more resistant to our immune system's antibody effects. So we need to make sure that all West Virginians, as the governor has said, who are in the most highly vulnerable age groups or who are immunocompromised, that you please stay up to date with your vaccines. And we mean that if you haven't had the primary series, please absolutely get the primary series. If you haven't gotten your first booster dose and you're eligible for that, then please get the booster dose. And if you're eligible for a second booster dose, then please get that booster dose, because the more recent that you've gotten your immunizations, the more your immune system can reduce your risk of having not only infection, but the serious consequences of infection, like hospitalizations or death. And we know that in the US, we have seen the number of cases go from about 30,000 in March now to well over 100,000 as of last week. And we'll see what we get today in the US. And hospitalizations have also increased about 20%. And in West Virginia, we have seen our R value now go up to 1.16, which means that COVID is definitely spreading. And we also have seen the number of hospitalizations to go up to about 138 with people with COVID, which is still substantially lower than we saw at the very peak of the hospitalizations, but it is concerning that we are seeing people getting infected more readily. Our percent positive rates are going up. And we know that this is most likely an underrepresentation of the true number of people infected because many people aren't getting tested or testing at home. So in order to help all West Virginians understand when it's time for you to get vaccinated, Jordan, I don't know if you can pull up the demonstration on the vaccine calculator. And what we'd like to point out is that we have created in West Virginia, really through the Joint Interagency Task Force and the Department of Health and Human Resources, the Bureau of Public Health, we've created a vaccine calculator that will help you understand not only when you should be eligible for another dose or a dose of a vaccine, but also which vaccine would you most benefit from. And for medical providers, there are new tabs that allow us to help you determine what's the best thing to do for your patients. So I don't know if we have the demo we can run through, Jordan. Good. So the first page that we get when we visit vaccinate.wvu.gov and click on the vaccine calculator is the introductory page. Next slide, please. And then you basically go to next and you come to read the welcome slide. And then this is a slide where you start to make selections. Remember that none of the data that you enter into this calculator is available for any one of the governmental agencies or anybody else. This stays on your web browser and disappears when you're finished with it. So it is very secure and safe for you to use. Next slide, please. So the first then part that you need to introduce is your birth date. And you put in your birth date because we know that there are different recommendations depending on how old you are. And then we'll ask a few other questions. So next slide. And then the next question will be, how many vaccines have you received? And on this one, it would be 1. Next slide. And then we would ask what type of vaccine you've gotten so that we can not only make a recommendation on when it would be good for you to get another vaccine, but which vaccine you should choose. And on this one, it's Pfizer. Next slide. And then as we ask, are you immunocompromised? Because there are clear criteria that are presented by the Centers for Disease Control outlined on this slide to go through to ask, do you have a reason why you should have a different dosing regimen, a different vaccination schedule because you're immunocompromised? In other words, do you take medicines like corticosteroids? Have you had a transplant, et cetera? Do you have HIV? Do you have active cancer? And on this one, we answered no. Next slide. And then it would basically ask when you had your most recent COVID-19 shot so that we can then use the calculator to give you the information about when you should get your next one. And I can't read that at my level, but you put in that date. Next slide. And then you basically find out that you are eligible for another vaccine, and here Pfizer, because that was your first dose, on Monday, May 16th, which is today. And then there is an opportunity for you to schedule directly with the vaccination so that you can go get it, which is the second line arrow. And if